I'm so delighted to get to join. Thank you all so much for having me, and thanks everybody that's took the time to be a part of the conversation. Yeah, very excited to join this for a number of reasons. Obviously, as an individual, Bob has been a transformational figure in my own life as I think about at every stage what it means to try to live a life of ethical leadership. He's been that model for me from since I was 12 years old, and at each one of these stages, always try to think about kind of what his lens on a given problem like this would be, and I'm hopeful that this solution strikes me as a very maybe the highest compliment I can pay to what we built. Is it's a very Bandoni-esque solution, I think, because we're going to hear is this is our attempt to build a solution that does bring together the nonprofit sector, government, and for-profit actors all in the same space, and uses all of their unique skills and their unique interests, we hope, to the common good. And so that's a little bit what we're trying to accomplish. And I should also say a little bit, for those of you that don't know, the organization I work for now is called Gary Community Investments, and it was founded by a man named Sam Gary, who's actually an oil and gas developer in Colorado, and very famously dug 38 dry holes in Montana before he found one that had a whole lot of oil in it. Was very, very successful. Sold that and then gave almost all of the money that he made to this foundation. But he calls it Gary Community Investments because his belief, like Bob's and like Shoulder to Shoulder, was that it's going to take all sectors of the community to be able to bring transformational change. You're going to need the for-profit sector, you're going to need the nonprofit sector, and you're going to need government. And so we're uniquely designed to be able to do all of those things. He actually left the money in two different entities. One is a foundation that does all the things traditional foundations do, and the other is a S corp, is a for-profit investment vehicle. So we use that to invest in organizations that are doing social good, but might be for-profit companies. It might be a new tech product that's going to help 3- and 4-year-old non-native English speakers learn how to acquire literacy skills before they enter kindergarten. Those are things we might make a for-profit investment in because we want to grow the impact, and we think that the market will help it do that. It also allows us to invest in things like policy change and political change, which most foundations by law can't do. So for those of you that are in Colorado, you'll see two measures on your ballot right now. One is Proposition EE, which is a proposal to create a universal preschool for 4-year-olds all across the state of Colorado through a tax on vaping. Colorado right now has the single highest teen vaping rate of any of the 50 states in America.
Wow.
And we're one of the only states that provides no tax on vaping. So that is essentially subsidized. Your high school kids would be paying more tax on a notebook than they would on vaping right now. So we are big supporters of that measure, which is an example of one of the things Sam Gary envisioned that we can now do. The other one is Amendment B, which we're a big supporter of, which repeals an old 40-year-old measure of the Constitution called the Gallagher Amendment, which has been every year crushing the funding for firefighters, for nurses, for local hospital districts, and for school districts. So when Jennifer jumps in later and talks about our school systems, we're losing about $1 billion of revenue every year for schools, firefighters, nurses. All you have to do is turn on the news anytime in the last year and see the very heroes who have carried us through this year, whether it was firefighters last night in Grand County or nurses or teachers. They would be the ones we'd be providing massive cuts to if we don't repeal this measure. So that's the kind of the range of things we get to be involved in because of, I think, Sam's shared vision with Bob here about what it takes to drive changes to bring all these organizations and sectors together. So that's why I'm delighted to join. I'm going to spend about 10 minutes maybe just telling you a little bit about this case study, what we built. We will build this into a case study, I think, for universities around the country. We have the Rockefeller Foundation has asked us to do it for governors and mayors and all the rest of the 50 states. And so we are looking at scaling this already. Bob, to your question, but I'll tell you about what we've done and why we've done it, and love to take your questions. Which is, if you go back to March 14th, which you remember kind of the day the music stopped and things started shutting down. I was downstairs getting lunch in my office building when the bartender literally got the notice that their restaurant was closing that day and he'd be out of a job. And that day, when I talked to the governor, we had in one day 500,000 Coloradans out of work, and we had in about a week 1 million Colorado kids out of school. And so when we looked at the scope of that problem, our foundation's focus is on supporting low-income kids and their families and getting access to opportunity. When we looked at the scale of, and the great majority of those 500,000 workers that had lost their jobs were mostly service industry. They're mostly people that are hourly workers who are making $40,000, $50,000 a year. did not have a lot of savings. So that was catastrophic. And we tried to think, what could we do to try to help get those folks back to work and get those kids back to school? The more and more we looked, the more we knew the biggest challenge was going to be the very three things it was going to take to try to help beat the virus. And that was going to be 1, regular and ongoing testing. 2 was going to be regular symptom tracking for people in all of their settings. And 3rd was going to be really aggressive contact tracing, so that when you found the virus, you could track it aggressively. And so we started our focus by saying, all right, the biggest economic and emotional drivers of every community are their schools. And so we know if we can't reopen schools, we're not going to be able to have parents go back to work because they can't take their kids anyplace. And we're not going to be able to revive the rest of the economy that comes back when those core institutions are functioning. So we pivoted our focus to what would it take to open preschools, K-12 school districts, and colleges. And we spent the last 4 months kind of building a model that we launched in June called COVID Check Colorado. And let me tell you a little about what it does and how it actually works. And then I'll tell you about the idea behind what we've been able to accomplish, which was at that point, if you remember, all of the focus was on symptomatic testing. So you wait till someone gets the symptom. When they get a symptom, then you come and test them. Well, early on, the problem with that approach is that right now what we know is that a full 40% of all of the COVID cases will remain asymptomatic through the entire course of the illness. That means you will get COVID, you will not have a fever, you will not have shortness of breath, you will not feel any different. You will go through 14 days of having the virus, shedding the virus, contaminating people around you, and you will never feel any different than you feel right now. Which means if you are only relying on symptomatic testing, even if you do symptomatic testing perfectly, you will miss 40% of the cases. And that's how you get massive outbreak when you think about putting a teacher back into school with 25 or 35 kids in her classroom, or if you're a high school teacher and you teach calculus and you have 5 rotations, you're seeing 150 kids a day, you could see thousands of people in a week that would be exposed without us ever knowing. And so we began pushing early that the key was going to be taking our most critical workers, like nurses and like firefighters, and making sure that they had regular access to testing. And we believe that teachers were going to be the critical frontline worker to make that happen, to help rebuild this economy. And so we proposed a process whereby we would regularly test every teacher in a school district, so that every teacher in the school district would get testing every 2 weeks on a rotating scale. And the way that would work is, and the first district we signed up was Aurora. So 4,000 teachers in Aurora Public Schools. The way we design is we're testing 4,000 of their teachers every 2 weeks. But by design, if you're a teacher or a principal, or you've just been a student, you would know what we don't do is take, say, Hinckley High School, which has 100 teachers, and test them all on October 1st. What we do instead is test 10 teachers at Hinckley High School every single day for 10 rolling days. And what you actually do is you test 2 members from the 9th grade team, 2 from the 10th grade team, 2 from the 11th grade team, 2 from the 12th grade team, 1 from the administration, so that you are every day getting real-time data into what's happening in your building. So if you have an outbreak on the 9th grade team at Hinckley High School, you're not waiting 2 weeks to see it. You'd actually see data every single day, which increases your chances of stopping that spread. In addition to that, we developed a symptom tracking program, which is an application or a website that we provide. Every morning, my daughter goes to Denver Public Schools, gets up, and she has to answer 4 tracking questions. Do you have any of these following symptoms? Do you have a fever? Have you been exposed to anyone who's positive? And then if all those answers are yes, they get a green light to go to school. That green light appears on the dashboard of her homeroom teacher, appears on the dashboard of the school secretary, school principal, school superintendent. You now know my daughter and any other student is clean to come in the building. If anyone is a red on any of those, if you do have any symptoms, we then automatically flag that student for immediate testing. So when I talk to you about our plan with Aurora Public Schools, we announced with Aurora Public Schools, and in 24 hours, we had more than 20 school districts who wanted to partner. So at this stage, we have now supported more than 20 metro area school districts that serve more than 500,000 students, which is more than half the entire student population of Colorado, and 10 of Colorado's colleges, which we've helped reopen. I'll come back to that in a minute. To do that, we've now had to stand up 8 drive-through testing sites all across the metro area. So we have drive-through testing facilities, like the one you would have seen at the Pepsi Center if you ever saw that one, that run from Boulder all the way down to Colorado Springs, which means any teacher that lives anywhere from Boulder to Colorado Springs is within 15 minutes of one of our drive-through testing sites, any place you want to go. She would come onto our platform, sign up, choose a time that works exactly for her. It could be 3:15 on a Tuesday. You drive up to the site, it takes 3 minutes to get the test. Within 36 hours, you have the test result back. And we've been able to make this available through philanthropy to districts at about $10, $10 to $15 per test. In a market where those tests normally cost $150 and the wait time is often 7 to 14 days for results, this has been a major breakthrough for us. But the reason why we stand up those drive-through testing sites is the biggest challenge are when a teacher or a student has a symptom. So we could just bring a clinic to Hinckley High School once every 2 weeks and test you. The key is when that student says, actually, no, I do have shortness of breath, or no, I do have a cough, you have to be able to test them immediately or test the teacher immediately. One school district partner, actually, Jennifer, is Cherry Creek alone. When I talked to Scott Sigford, who's the superintendent of Cherry Creek, last year in the month of September alone, they had 7,000 students who came to a nurse in the month of September with a symptom that would have qualified as a COVID symptom. That means if you were just testing symptomatic kids alone, you'd have 7,000 kids per month per district. So what this has enabled us to do is not just test all the teachers on a regular basis, test students as soon as they're symptomatic, and then symptom track every adult and kid before they enter the building on any given day. The third and final step is one of the reasons why people were worried about doing symptom tracking, or I'm sorry, about doing asymptomatic testing at a broader scale, is they said to us, this is quite funny, but if we test all these people, we're going to find so many more positives. And how will we deal with that? And we said, I would rather know than not know, it turns out, right? And so what we said, okay, that's fair enough. Local public health agencies will be potentially overwhelmed with far more cases. And so they said, it probably is going to cost us $50 million to try to find the resources we would need to hire the contact tracers you would need, probably 1,000 of them, to serve all of this increased demand. And we said, okay, let us solve that. I tend to think there are a lot of people in the world, like the folks on this call, who want to make a difference, want to serve their country, want to support states in being responsive to this. So we entered a partnership with AmeriCorps. We reached out to AmeriCorps and said, hey, we have a great need for contact tracing. We know a lot of your sites have been shut down. This was March, because if you were in a school in Philadelphia, that school's closed now. What are those people doing? They said they'd love to help. So in about 3 weeks, we got 1,000 AmeriCorps contact tracers assigned to the state of Colorado at no cost to AmeriCorps, no cost to the state. Many of them did it remotely. All we did is we provided them all with laptops and a phone. So they could be sitting in their home in Delaware or in Philadelphia or in the Mississippi Delta, wherever they were assigned. But they were now on staff for Eagle County Public Health or Denver County Public Health to be able to do contact tracing as soon as those cases came in, to be able to quickly trace them. The other thing we do on our application is the last thing we do, and for the teachers in the room, Jennifer, I keep signaling out you, but as a fellow educator, I know you know what this entails, or the principals certainly, Bob. What we do also is every teacher and every student, that every day when they do their symptom tracking, the final question is, tell us everyone that you have been in close contact with in the last 24 hours. So if you had a meeting with the 9th grade team yesterday afternoon from 3 to 4, I would say, okay, Jennifer and David and Jane, I was all with. I had a meeting with Bob in his office yesterday. Sally and I did lunch supervision yesterday afternoon, and you track that. The reason why you track that is if 6 days from now, Jennifer gets a positive test back and I'm the principal, I have to know right now what teachers have possibly been exposed to Jennifer to call them off tomorrow, find subs for them tomorrow, get them tested tomorrow to immediately track that. And if you call me and ask me right now who I saw 6 days ago, the human memory is terrible. And this is why contact tracing doesn't work, except for in places like, China or Hong Kong, where they would literally track your phone and they would use the Bluetooth signal from your phone to know who'd been exposed to you and immediately notify those people. In a place where you want to not do that because of civil liberties, you have to be much more aggressive about people's memory. So that's the soup to nuts system that now allows us to regularly test, to daily symptom track, and then to aggressively contact trace. Then I'll just tell you, with that result, we have now put more than 150,000 students back to in-person learning over the last 6 weeks. We have done more than 100,000 tests of educators. We have stopped more than 300 outbreaks in K-12 schools alone. I'll tell you, on one day, in one district, we caught 4 asymptomatic teachers on one day. That all would have walked into one district. You would have had 4 outbreaks, 4 schools, all shut down. And so that's been a huge success. We've opened 10 colleges, most notable Colorado Mesa University and Fort Lewis, both of which Fort Lewis College is 80% of their students are in-person classes every day, as if COVID didn't exist. tested all their students before they ever returned to campus in the first place, and then sample about 20% of them we test every single week on a rotating random basis. CMU, Colorado Mesa University in Grand Junction, also been open since day one without any major outbreaks either. So the most successful campuses in the state, I think, have taken this approach and it's worked. And I'll just close by saying, and our next step is now we've started testing early childcare centers. And we go to those centers, we're testing teachers, we're also testing students, and we're also testing family members, because you have a lot of, in our low-income communities, a lot of kids who live with grandparents. And if you're a grandparent and you want your 3-year-old to go back to preschool so she gets the academic and emotional support, but you're in an at-risk population, it's very important that we know that the teachers are safe, the kids are safe, and the family members are safe. So we're going to be prepared to now scale this to preschool settings around the state. And we are now preparing to open a pilot where we will begin testing middle and high school students as well as teachers, because we know the transmission rates among students may be or can be as high as among adult populations. So that's a little bit about the context of where we are, what we've done. I'll close by saying our deep belief was, if you looked at the place the state and the country stood in March, what we knew was the impact of closing schools for a long period of time was going to be devastating. We're looking at right now what I call like 3 consecutive summer slides, right? Which is, the educators know the summer slide is you get September to May to get all your kids caught up. When the summer hits, if you're in a low-income family that can't afford to send your kid to camp all summer or to do tutors or to go to amazing, engaging experiences, that learning atrophies and kids slide all the way back down, and September we have to start all over again. Well, what happened this past year is that in March, we started that slide 3 months early. 50% of Latinx kids in the state of Colorado, 50%, do not have access to either a laptop or wireless devices. That means if you are doing online school, you are doing no school for 50% of the largest minority population in the state of Colorado. That's 12% of all the kids in the state would have no access. We knew that was going to be, and then you added the actual summer slide from this summer loss. And now you added a whole other fall semester with another summer slide of no real content. There are projections now that say that it's possible these 6 to 8 months of slide will eviscerate 15 years of achievement gap closing since the year 2003. So when you think about what the scale was for us, there was no universe in which we could be agnostic about whether or not we should or shouldn't reopen. There was also no universe in which we were going to ask teachers to go back into the front line of exposure without the protections we would provide to firefighters or nurses in the same way. We're very proud of the fact right now that unless you play for the Denver Nuggets or the Denver Broncos, there is no one in the state who gets more access to regular free testing than teachers, than public school teachers. And so we thought that was as it should be. But I will just say the costs beyond that are also dramatic. Academic gains, we know, matter a lot. Any teacher will tell you, and many superintendents, Jennifer's superintendent, I have a lot of respect for, Scott Safety at Cherry Creek, has said this very clearly. We just know that our kids need us, right? We've also seen dramatic increases in domestic violence cases over the last 4 or 5 months. We've seen dramatic increase in serious child abuse deaths or major bodily harm. And we've seen dramatic reduction in child abuse reporting. Why? Because the trusted adult that our entire system relies on to be the one to say, hey, baby, why do you have that bruise on your arm? And what happened there? Is a school teacher, right? When you have homes that are under much more financial stress, much more domestic stress, much more abuse, and no other trusted adult in their life to see them and check in with them and talk to them, then yes, you're going to see significantly increased risks of adolescent depression and suicide, significant increased risks of anxiety, significant increased risk of domestic violence. This is the highest record. My wife is the chief of the juvenile division in the DA's office here in Denver. This is the highest record of juvenile murders in Denver in 20 years. And so when you look at the outcomes of what's happening to kids who don't have positive places to engage, I think it goes well beyond the academic losses and the economic ones, but we think those are paramount. So I'm happy to answer questions, but this is a place where we thought if you could bring together for-profit actors and government partners and philanthropy and nonprofit entities to say, how do we actually create a model for the rest of the country that shows you can reopen the economy and you can reopen schools, but you can do it with maximum protections and real public health guidance and public safety, and do it in a way that serves kids and adults at the same time. We think this will be that model. And so that's why we've done what we've done. And that's why we hope this will advance the conversation about what's possible when you bring together the leaders you're bringing together from multiple sectors to try to solve the country's hardest problems.
Mike, thanks. Wow, there's a lot going on. I guess maybe you can get our panel going even with this. Is what's going on right now as far as growth goes? Growing this program, getting more schools involved, not only in the Denver metro area or even in Colorado, but even beyond. You said that. I think Rockefeller Foundation maybe is getting involved. Can you tell us a little bit about that?
Yeah, so you know, the Wall Street Journal is doing a piece on this. They called, and you know, their reporter who covers all of COVID said, you know, my only job is to cover COVID response in all 50 states all day, every day, and to cover schools in all 50 states. And he says, I've looked across the country, I've not found a single example of anyone who is doing this. There's no other state that's approached this as a comprehensive, you know, vision for how to support employers all the way through.
Right.
We're doing the same thing now with restaurants statewide. I think restaurant workers are also heavily exposed, and they provide a core public service. They employ a ton of low-income workers. We're doing the same with foster care facilities statewide. We're doing the same with elder care facilities, many of those most at-risk populations. And then we'll expand to early childhood. We are expanding to school districts around the state. The benefit is in some of our rural areas, the transmission rates are also much, much lower, so the risk is lower. So we're working on partnering to do remote delivery in those places. And then we have colleges around the country now who have called to ask us to take on colleges. So we do have college partners in probably 10 other states that we'll be adding over the coming weeks. But our real focus is on getting to scale in Colorado and turning the tide of openings. And so we're also going to do a deep community transmission. Right now, what you're finding, not surprisingly, is this virus tracks all the inequalities that you see in the rest of the world, which is when people say, wow, the Denver transmission rates are really high. That's actually not true. The transmission rates in Stapleton, where I live, are incredibly low. The transmission rates in Cherry Creek and Hilltop are incredibly low. The transmission rates in Montbello are astronomical. Transmission rates in West Denver and Southwest Denver are astronomical. We did a drop-in clinic. Denver Health did one in Thomas Jefferson High School, which is in Southwest Denver, tested 100 people last weekend, 30 positives out of 100. That's a 30% prevalence rate. And so there are communities where we know the impact is dramatic. And a lot is because those are our frontline service workers that are out every day, not because they're being irresponsible, but because they're trying to put food on the table for their families. So we're going to open sites in those communities that will serve any drop-in people that want to come in for regular testing. And then we'll also work on pilots with middle schools and high schools who are going to try and be the first to open some of the bigger, more complicated campuses with the hopes that we can get those kids back into school in the coming months. So that's a little bit about the growth plan that's coming. But yes, Rockefeller has said, you know, they're building a white paper on this model to take to the National Governors Association, the other 49 governors, to say, we think here is a model for how you can approach a safe and responsible way to reopen that would help kids and adults both.
Okay, thanks. Jane.
Yeah, I just have a question, Mike, about the mental health piece. You know, we can fold into that the stats you've been talking about, which we're hearing around the world, right? You know, domestic violence, child abuse, the reporting, the loss of the trusted adult. And many schools, if they're lucky, hopefully have a school counselor, school social worker. And I'm wondering, with your model, is there room for that piece? Does it need to be added in? Are they enough in the mix when people test positive and there are maybe shock waves going through a family or through a school? Or is that not part of this model at this point?
No, great question. We do have medical. So anytime someone tests positive, we have a nurse or a doctor who calls them directly and walks them through what it means, what the next steps are, what they should do, what supports they might want. And then we are offering, obviously, testing to to families, or if there is a positive, if there are wraparound supports for families, if they want to do that. I think, Jane, you raised a more profound question of kind of what does the mental health support look like in this moment for all the kids, not just the kids who are positive. And as you know, it's very hard to do that by Zoom, and so counselors who are doing heroic things to try to find a way to reach out to kids and keep them engaged. We are doing more to work with places like Aurora to make available those mental health services to families, even if they're not yet back in person. But our real belief is that the best way to do that is to be able to have the human connection of people being in person again with the right safety protections. And so that's why our hope is the in-person contact helps deliver that. But I think, Jane, to your point, there is going to be an absolute, yes, there will be a avalanche of academic deficits to recover from, there is also going to be an absolute avalanche of mental health needs and supports that we're going to have to recover from. So this is going to require an incredible infusion of mental health support, I think, as well as academic support. And we are in some conversations with a couple US senators and national leaders, and including the Biden team, around how to think through what an infusion like the AmeriCorps effort that we led around contact tracing. Is there a similar infusion of talent around both tutoring and support for kids who have support, and a mental health core
Right.
that would be an infusion to provide that kind of backup, knowing how grave the needs will be there too.
Nice.
That sounds great. And just to finish my little piece by saying, we might look overseas because there's such an emphasis on paraprofessionals, or what they call lay workers, delivering tricky psychological interventions actually all over the world now that we know about the early brain science and what people need between parent and child. So there might be some lessons to bring in from there.
Who do you think does that best, Jane? Who would you suggest we look at? What would be your country exemplar?
Well, the country I work with a lot, so I'll put it that way, is South Africa, where they were, part of that initial army around HIV transmission in the early days. And in fact, it's really amazing to look outside the United States and see that countries in Africa, for example, were actually much better prepared because they've gone through Ebola and HIV and had a lot of lessons kind of very cemented in the community around how you get preventing things. So I could talk to you later about maybe some people to talk to there.
That'd be wonderful.
Have you seen any anxiety in like the frontline workers that were repeatedly testing?
Oh, good question.
We have seen a lot of anxiety and concern about workers returning to work settings at all. And I see that in my office, and we only have 30 adults here, not 500 kids. And so I think very real. And a lot of the teaching force is older at this stage. And so we have a lot of teachers who are in potentially high risk categories. And so what we've tried to help districts do is partner the parents and kids who do not feel comfortable being in person with the teachers who don't want to be in person. So in a perfect setting, you have 50% of your kids who want to come back and 50% of your teachers who want to come back. And those teachers can support those kids, and the other teachers can support other kids online. As all the educators in this call know, it's never that simple, because you might have 3 science teachers who want to come back and 3 math teachers who don't, and that doesn't make it work very well. And so it's not been easy. And I think the real challenge, what was crushing districts the most, was the toggling back and forth between opening and closing. So a teacher gets ready to open an in-person lesson. She has an entire curriculum design. And on day 2, there's a positive case. Everyone gets sent home. And now you all of a sudden got to make that an online 2 weeks. That's not possible thing to do really well. So we've done a lot of work with the state public health department. I mean, this is fascinating in terms of regulations and guidance, but I will give a lot of credit, Jennifer, to Cherry Creek and to Scott Siegfried there, because they really pushed on helping us. We changed the guidance on this, because what previously happened was if you had a positive in your cohort, you had to send the entire cohort home. Well, if a high school has 1,500 kids and they do an A day, B day schedule, 1,500 kids on one day is considered a cohort. So they literally had 2 positives. We're going to have to send 1,500 kids home for 14 days. That's 15,000 lost days of instruction for 1 positive. And so we changed the guidance to where now, using the contact tracing system and seating charts, you would know what 2 or 3 kids were actually within 6 feet and exposed to that child. Those 3 or 4 kids were quarantined, not 1,500. And most importantly, honestly, not that the kids aren't super important, but most importantly, those 5 teachers can come back to school the next day. Because what killed you was if you have 1 positive and all 5 of your teachers in the 9th grade team have to get sent home, your 9th grade team is closed. And so it was the ability to both protect teachers physically and protect the guidance so that they wouldn't have to be quarantined every time there was a positive if they weren't exposed. If you have a 9th grade kid who gets sent home because of a 12th grade positive, when they're on opposite sides of the building, it doesn't make a lot of sense.
I'll add that I appreciate what you're saying, Mike. However, I don't know if you read how the CDC yesterday changed their definition of close contact. So now I'm wondering how that will change the whole cohort and quarantine procedures.
I think that I've not read the new CDC one, Jennifer. I need to. Ours are still very conservative, and then it says only if you can prove. So anyone that has been within 6 feet of one person for more than 15 minutes unmasked, so within 12 feet unmasked, or within 6 feet masked. And so the presumption is everyone's exposed unless you can prove otherwise. So you'd have to prove that you have a seating chart where a room only fits 15 kids. They're all 6 feet apart. They all have masks on. The teachers is 10 to 15 apart. Teacher can't be walking up and down the aisles, right? All sorts of instructional tools you can't use anymore. But if that's not the case, everyone still gets quarantined. What it just allows educators to do is, if you can build systems that say, we're going to say, only have 2 rotations of classes that move back and forth, and they'll all be socially distanced, that can be, it can be safer. I have not seen the new CDC guidelines. We've had a lot of success with very low transmission rates with those protections so far, but I think there are a lot of schools that are frankly being quite irresponsible and putting teachers in harm's way. I think that's a bad idea.
I have another question.
Please.
So I hear about some teens, so middle schoolers and high schoolers, and some parents who aren't being entirely honest with trackers, and this is with districts all over the state.
Yep.
And so I just am concerned about what incentive we create for students to be honest with those trackers, and then honest with getting tested, because I also hear that some families don't want their student to be tested because then it may close down the school.
Yeah, so great question. And actually, I should have mentioned this before. Most all of our school district partners are making the testing available to teachers on a voluntary basis. So there are a lot of teachers who are choosing not to be tested. And we, those districts, I think, cannot or choose not to force them to be tested. And so I think that's a free choice, right? As if people don't want to do it, it does mean there are the risks that you have adults coming to the building who haven't been tested and could be positive. I think that's at their discretion. For students, we're not doing broad scale comprehensive student testing right now. We're just doing symptomatic students. We're starting with a pilot of those students. And what we found is a lot of interest, because just what you said, Jennifer, is I think the incentive is most of those young kids of all ages want to be back in school. And they know if they're irresponsible with those practices, then it's going to get the school shut down. You see that no place more evident than in colleges, right? I think the biggest challenge is you get kids go to a college campus and they want to see their friends. They want to go to parties. They want to go on dates, like all the things that are probably not good COVID practices. And so I'd say the colleges have done really well, have built a real esprit de corps. I think Colorado Mesa University has done a great job in this in Grand Junction to say, like, we're all in this together and we all want to be back at college. We all want to be on campus. We all want to be here. But if any one of us is irresponsible, it threatens all of our ability to do this. And I think that's been the most successful version of it. And I think so that kind of positive support and reinforcement has mostly been helpful. I do think if we start to get a lot more positives of teachers or kids who are untested or undetected, you'll probably see frustration rise about that and more public pressure. But for right now, I think the places where we've successfully caught the asymptomatic positives have really reinforced to educators to say, this is a real risk. Even if you feel fine, it's a risk to you and your family and your friends. And if you can get this service for free, no reason not to do it.
Hey, Mike, first off, this is really needed. And secondly, outside of COVID, and granted that this has probably been taking, 115% of your time, what do you see as the 2 or 3 other major issues bigger than Colorado that your group is working on that need a nonprofit and government collaborative solution?
Great question. Yeah, it was hard to pick. It's like picking your favorite child. I was loath to only talk about this one effort because we have a couple of others I'm very excited about. I think the other major one we're leading, which we're just developing right now, is what does the country do about these deep questions of racial justice, and what can we do to begin to repair some of the really systematic oppression and harm that's been done. I think the outpouring of support has been incredible. I also think that has to lead to action for it to lead to change. And so what we're focusing on, David, is I think we've looked hard at the research, and the single most, I would say, devastating and divisive instance of racial injustice right now in this country is the wealth gap. People will talk about income gaps. When you look at what racism has done over the last 400 years, it has systematically interfered at every instance when an African-American would have been able to accumulate wealth. So if you could have gotten access to land, that was stripped from you. If you could have gotten access to college, that was denied to you. If you could have owned a home, that was redlined away from you. If you could have gotten the GI Bill, that was denied to you. Like every instance where generation you could build wealth, that was deprived. And so what you see right now is that if you look at families with children, so families with school-age children, the accumulated wealth of a Black family with school-age children is 1 cent for $1 of every white family with school-age children. It is a 100-to-1 wealth gap. Like, that's what you get with 400 years of compounded policies of explicit racism. And so our belief is we can make a big impact on that by creating a fund dedicated to resolving that wealth gap. And our belief is, there's 2 great articles you should read. One is called What is Owed, which is in the New York Times about a month ago. The other is Ta-Nehisi Coates, I'll put it in the chat, wrote an article on reparations in the Atlantic Monthly several years ago, which is still the most read piece in the 120-year history of Atlantic Monthly. But when they talk about reparations, our case is that if we could make that capital available, so our proposal is we're going to create a loan fund that would allow any Black family in the state of Colorado to get access to $30,000 of capital for any purpose, for a college, to attend college, to start a small business, to buy a home, to pay off 19% credit card debt. And our belief is that that is not an application, that is an entitlement. We believe that is what is owed as some small part of the economic injustice this country has propagated on African Americans. And that every white family, I know my own is true, has a story of some father or grandfather or grandmother who pulled themselves up by their bootstraps and built their family a fortune. And they did it because guess what? My dad got a loan from First Bank in Vail, Colorado, when his only record was being a recovered alcoholic with a failed business. Like, there is no Black man with my dad's profile that gets that loan in 1973. And so I think what we're going to look at is, how do you say we're going to do what families have done in this country for generations, which is invest in people because they believe they have the capacity to get it right, and make those loans available to any family that wants it, and help them with financial counseling and support, with the belief that we will get great returns on these funds and show this is not only what is owed morally, it's actually a great economic investment for the country. So that's one that has never been tried before. We're going to try to build a model here in Colorado and then urge the other 49 states to follow us on that one. I think that's critical. And then the other, go ahead, David. You're on mute, David.
Just staying on that one, which I think is critically important. What's the dollar amount that you think is necessary in Colorado to affect that? And a loan obviously implies that there's a repayment. What's your thoughts on terms? And is there a mechanism that it could be an equity investment, or a gift, or is it all a loan?
Great question. So obviously, I'm persuaded by the argument that there should be a real robust federal policy around reparations, and that involves, cash transfers that are not repayable. So I'm not arguing at all that a loan solves the moral injustice of the last 400 years. But to your first question, we do think it works at a financial scale that is possible. And so I'll give you the example, David. You know the math quickly, but 75,000 Black families in Colorado at $30,000 per family. That's around a $2 billion loan fund. But the way loan funds work is, right, that's going to be out of a 2, 5, 7-year cycle. So you only have to have around $500 million in a guarantee in the corpus at any one moment. So you need about a $500 million guarantee fund to leverage that solution for the entire state of Colorado. That is a solvable amount of money. And we're going to start a pilot. And because, as you said, David, it's what we would call a program-related investment. We're going to give it out at zero to, at low to no interest, maybe 1%, 2%, next to nothing, to just cover costs. But that means if you make that money back, that's what enables you to reinvest it in the next family. And so, whereas if you did a straight cash transfer of income, which I think is a great argument to do, it's just the numbers get into the trillions very quickly for what the cost is on that. It's not to say America shouldn't do it. We just think that's going to be a much longer argument. And so we think we want to prove what can be done right now. And we're going to do a first fund of only about 6 million with a first pilot of about 1,000 families in one zip code in Denver. And we're going to intentionally, David, bring people in at all levels of credit score. So there's no application, there's no criteria. If you're 23 and never had a job before and been in and out of incarceration and have a plan for a small business or have a plan to get yourself your own home, we're going to support you in doing that. And then we're going to demonstrate what the loss rates are across that portfolio to figure out what we need to assume as the loss rates to scale to the full $2 billion fund.
As a documentary filmmaker by first career, I think you have a lot of film film stories right there and what people do and how it unfolds. So
Yes.
always remember to document.
We will try to do that. Yeah, I think we have a lot to learn, but we think and this is, to Bob's earlier statement, there are places, I think, David, what you're suggesting, there are places where government just can't move fast enough. This has been, John Dingell, I think, had a proposed bill to study reparations that's been introduced for 30 years in the US Congress, never had a vote. And so here, as a nonprofit, as a foundation with private capital, we can say, let's move quickly on actually an effort to pilot this and make it work. And we'll make mistakes. We'll certainly fail on things, and we'll learn from the pilot, and we'll get better. We'd rather start acting now and build a model that's going to work than wait for 15 years of subcommittees to study it. We think this is a place where you can move quickly and iterate quickly with kind of for-profit and nonprofit partners.
Folks, I was so drawn into all of this that we're 5 minutes over. Quickly, Mike, thank you for drawing us into this conversation, and obviously for the work that you're doing, and not only into itself, but the potential to see this scale, not only in Colorado, but beyond Colorado and so on. And that's, there's such integrity to what you're doing here. And I'm not surprised that you're the one leading it. So thanks so much for this. I would tell folks here that we can take this discourse, and this session is being recorded, and it will be available for everybody probably within a week or so. So we can take this audience, or we can take this session and bring it to our audiences, and in that way we can help Mike get this done.
Thanks.
Well,
into that.
I'm so grateful for being a part of it. Thank you all for letting me join, and looking forward to the next couple of days and all the good conversation that will come out of it.
Okay.
Yeah, and to that end, on the link I just shared there, it has all of the panelists. It has Mike's contact information for LinkedIn. I tried to get the articles that you were mentioning, Mike, but feel free. I think I missed the New York Times one, but the rest, as you were talking, all the articles that Mike mentions there, as well as the presentation that was sent to the panelists. So for those people watching who didn't see that, if you'd like more information, just click that link, and that's all the resources that were shared with everyone today.
Okay, great. Thank you, everyone. Mike,
Thank you.
Thanks, y'all. Have a great afternoon.
You too, Mike. Bye-bye, everyone.